Thank you, Chairman. I'm going to continue along some of that discussion about fraud and AI, and would love a little bit more perspective. Trump administration's been forward-thinking on artificial intelligence throughout all federal agencies. So, Ms. Clark, I'm geared to take this question to you first. HHS is no different. Secretary Kennedy told us last week that HHS is using AI technology to detect fraud, and that he's ending the pay-and-chase system that has drained the system for years. Can you discuss how the use of AI at Health and Human Services can reduce fraud and preemptively stop payment to bad actors before the money actually goes out the door? As well as what kind of involvement HHS staff have in verifying that flagged accounts are truly fraudulent. I think being able to get the systems payment piece right, which is so basic for many companies, is one of the biggest areas of potential that nobody on any aisle in any spectrum politically could ever disagree with. Can you expound on that a little bit?
Absolutely. I have not had direct experience with HHS, but in my state of California, in working with our plans, what we have done for AI is you have a hospice patient that, and I had mentioned this earlier, that has end-stage pulmonary disease. And that election is submitted, end-stage pulmonary, but they are on no medications, no ER visits, no hospitalizations, no specialist visits. And that is the stop right there to say, wait a minute, you're saying this patient is end stage, but they have no history, no claims, nothing. And that we have been able to stop it at the front door and say, no. And then when we work together, we call the patient and they're like, no, I don't know who this hospice is. I'm perfectly fine. So being able to get at that information, and it is all there. The claims data is there. The information is there. You just need to look for it. That's why I say look at the beneficiary level. Start there.
Love it. And I think that can be broadly applied across multiple agencies and different disciplines across the world.
Yes.
So, thank you.
And different, not just hospice.
Yeah, I appreciate that, and I think it's excellent to be able to identify how a success that we've had can permeate through other areas. And with that, Mr. Chairman, I will yield back my time.